Telemedicine in Africa. Telemedicine in Africa is the new way to solve the healthcare problems. A group of young medics, a group of young professionals in medical and information technology came together last year and decided to provide a solution to the very many health challenges facing their communities in Uganda. Aware of the facts that a doctor-to-patient ratio is 1 to 25,000 patients, according to statistics, these young medical and information technology professionals decided to come up with a program to reach the patients where they are located. They have been moving around remote villages, often met with very many challenges of transport, rugged roads, potholes, muddy roads, and sometimes unreachable hilly areas. But these young people haven't relented. They have used the borders, they have walked, and they have reached the old people who were at the blink of dying, even from preventable sicknesses. This group is called Total Care Telemed. We are a medical and technological company that is providing medical services to people in remote places, vulnerable communities, and also the most deserving areas of rural Uganda. We are so proud to have a big team of young professionals in medical and information technology that are putting the technological tools together to make sure we can treat our people wherever they are. We boast of a line of professionals in consultancy, physicians, midwifery, and laboratory attendants, and all the medics that we have that are providing these services using technology. And we are also proud of the people that have supported this program. We are located in Isingiro, Nachivale to be specific, but our work and impact goes so far beyond our physical location because this is what technology is about. We call upon you to support this program in any way that you can. If you would like to partner with us to make sure health is availed to everyone in Uganda and beyond, you are welcome any day. Our office is open, and again, we want to thank you and we wish you a great health from Total Care Telemed. A doctor is just a call away. And they are leveraging the power of technology to improve health service delivery and access. After opening an office in one of the remote areas and a refugee settlement area, they realized that their services are much needed in the vast majority of economically disadvantaged people of Uganda who mostly live in villages and whose lives are at stake owing to inaccessibility to the mainstream health facilities and often the long distances that has hindered the movement of those who cannot afford the transport costs. From avoiding long queues at the government hospitals to a lack of follow-up for the patient, Total Care Telemed is providing a comprehensive solution to the layman, to the underprivileged, and to the most deserving people of the society. We reached the Telemed clinic in Achivale refugee settlement, and we found Total Care Telemed professionals doing a sensitization campaign involving mothers, children, and the campaign was about sensitizing them against self-medication. Many of them said many of the patients, when asked, they said that their only way to get health care is to go to a drug shop and buy medicine without prescription, without screening.
The challenges majorly and the diseases mostly that are always around, majorly it is the malaria disease. Malaria has been a threatening disease to younger children and the elderly. And the upper respiratory tract infections and the STIs and mental illnesses due to trauma and some other psychiatric conditions that have affected the POCs due to loss of their loved ones and their property.
Okay.
And there are different other health services that would be requested. I would say the human resource in the health department is still a little bit low, and if it can be improved, fine. The medication, fine. If it can be in place, it can be okay.
Okay.
Then I think that is what to be done. Also. Then what to be done is just to improve the health system.
To improve the health system. So what do you think should be the areas where improvement should be made? Because Total Care Telemed is pushing for a technological approach where patients should be able to be in touch with health service providers through SMSs, through the phone calls, through WhatsApp, to be reminded to take their medication, to ensure adherence to medication, and also to make sure that the doctors or the health service providers keep tabs on the patient. Do you think that is in any way going to improve health service delivery in the settlements?
We see it so paramount if that technology can be in place, because at times we have most of the POCs around the community. Most of the population is illiterate, and in case that service of reminder the patient.
And Total Care Telemed is addressing the self-medication and self-diagnosis that most patients have been practicing for a very long time. with all the disadvantages that this challenge may present, including but not limited to adherence to medication and drug resistance. The group is hell-bent on helping very many patients seek a doctor's advice before they can start treating themselves. Most of these said it's very hard to get a doctor to pay attention to you. And Total Care Telemed is saying by their motto that a doctor is only a call away. And they are providing a toll-free line where the patients can make a call whenever they need help. Clinical officers, nurses, doctors, and consultants are all online waiting to help the next patient, and the doctor is able to make a treatment procedure with the help of a consultant online. And this is making healthcare easier for most people who would have never dreamt of this. This sounds like a dream. But we have met these young professionals in medicine visiting churches. Twina Masco Crinard, a lab technologist, is a part of this group of young professionals that are campaigning for proper screening before patients can be prescribed drugs. He has attended church services in the most remote areas of Western Uganda to sensitize people. And he has been overwhelmed by the response. In his own words, he says that after doing some screening, almost half of aged men tested positive for prostate cancer. We have seen Total Care Telemed have traveled so far and near, only to find some patients lying in churches waiting for a miracle when all they needed was a doctor's advice on what proper medication they need. Challenged by low incomes, most of these patients often choose to die than going to the hospital. But outside of that, there are many advantages to this practice, and one of the clinical officers on the team was able to tell us what they have been able to achieve and what more they expect to achieve by practicing this telehealth practice.
With Total Care Telemed, it helps us reach our clients very fast, and it's reliable because it's all about using technology in terms of phone calls. It can be through a WhatsApp message, it can be an SMS, it can also be through an email. So it helps us in monitoring our clients who are on treatment. We can also do clinical assessments, as well as monitoring patients' drug adherence. Most especially those people who have chronic illnesses such as hypertension, who are diabetic. It helps us tell them it's the right time to take their next dose. They can tell us how they feel, most especially after a night. So it is easier for the clients to reach to their healthcare providers.
This sounds like a new ray of hope for people living in very remote areas and people living in settlements where healthcare may be a big challenge. With so many medics graduating from medical school, this looks like a great innovation for most of them to put their skills to work, to change their communities, to provide solutions for problems that have been standing for a long time. And we really believe that with support from all able people, governments, organizations, health promoters, and local leaders, this is a cutting-edge health solution to most of Uganda. Total Care Telemed, a doctor is only a call away. In some areas, Total Care Telemed has established telehealth centers where telenursing is done and where people are called to do massive screening. We have seen lab assistants and technologists carrying delicate equipment to these areas and taking blood samples of locals who for the most part have said they have never had any screening. They have never done any blood tests. Molly is one of the laboratory team at Total Care Telemed, and she told us how this is done.
So this teletesting has done it so very well that if we happen to go in the field, reaching those sick patients, sometimes we don't move with these equipment. So we collect samples and bring them in our laboratory, test them, and then take back their results in time. But then the problem we faced, there are sometimes we come back and there is no electricity, so we have to allocate and go where the electricity is in order to give results to our clients in time.
For example, today you are sitting at the city grounds in Achimale. I think they have a good solar system. So it looks like you also travel with your equipment, be in this space, and then have all your samples worked on.
Yeah. Now, to answer that question, today I am at CTA because they have got good and big solars, strong ones. Because now I was in the field yesterday, collected samples from my clients, and then on reaching, there were no electricity. So I had to come at CTA where I know that they have powerful solars, carry out my tests in order for my clients to receive the results in time.
Okay, so when you get the results, how do you avail them to the owners? You give them calls to people them, or do you take them to wherever they are?
Whenever I am done with testing, I take them to wherever they are.
Okay. Okay, thank you so much.
You're welcome.
And there are very many advantages even to the health practitioners. Very many doctors and nurses have reported that they are able to attend to patients with the support of physicians, consultants, and other experienced health practitioners by using technology. And this is helping most of these health practitioners to get more experience and make very well informed decisions.